On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, What About HIPAA? My name is Kathy Reynolds, and I will be your moderator for this program. Now I'd like to introduce our speaker for the webinar. Joanne Adkins is a registered nurse and senior infection preventionist for the Patient Safety Authority. Ms. Adkins is board certified in infection control and epidemiology and is a fellow of the Association for Professionals in Infection Control and Epidemiology. Ms. Adkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention and has served on the Member Services Committee, the Sigma Theta Tau International Nursing Honor Society, and the Pennsylvania Association Directors of Nursing Administration Long-Term Care. Joanne, I will now turn the program over to you.
Thank you, Kathy. Emergency situations and natural disasters, such as flooding or pandemics, can quickly overwhelm a healthcare facility. The last thing on people's minds in those situations is complying with the HIPAA privacy rule. Sometimes, but not always, Health and Human Services steps in and issues a waiver for some of the requirements during a disaster. And this happened during Hurricane Florence, when the Secretary of Health and Human Services waived sanctions and penalties for certain provisions of the rule in areas that were affected by the flooding. Those organizations were given a 72-hour waiver from the time they first implemented their disaster protocol. But not all emergencies come with a reprieve from adherence to the law. During crises that do not include a HIPAA waiver, facilities that do not have a clear understanding of their obligations to patient privacy may risk liability and potential penalty for noncompliance. During an emergency situation, facilities should seek a balance between disclosing resident information when necessary to respond to the emergency and protecting the residents' privacy. And this balance should be incorporated into your emergency preparedness and response plan. So here's our objectives for today. To do a brief review of the HIPAA, the Health Insurance Portability and Accountability Act, to identify the allowable HIPAA privacy rule disclosures during an emergency, to discuss Section 1135 of the Social Security Act waiver during an emergency or disaster situation, to list the 4 core policies of healthcare ethics, and discuss the events during an emergency that require incorporation of sound ethical consideration. HIPAA is federal law that was enacted in 1996. It required the creation of national standards to protect sensitive resident health information from being disclosed without the resident's consent or knowledge. The Department of Health and Human Services issued the privacy rule to implement the requirements of the HIPAA Act. The privacy rule addresses the use and disclosure of an individual's health information, also known as your protected health information, by entities that are subject to this rule. These individuals or organizations are called covered entities. The privacy rule also contains standards for individuals' rights to understand and control how their health information is used. A major goal of the rule is to ensure that a person's health information is properly protected while allowing for the flow of health information needed to provide and promote high-quality health care and protect the public's health and well-being. The privacy rule strikes a balance that permits important uses of information while protecting the privacy of people who are seeking care and healing. The privacy rule protects all individually identifiable health information that is held or transmitted by a covered entity in any form, whether it's electronic, paper, or verbally. And this information is your protected health information. Your protected health information is information including demographic data that relates to the individually identifiable information in any form or media. It is past, present, or future physical or mental health issues. any provision of health care that person may have received, any past, present, or future payment for services, any information that can be used to identify that individual, such as name, address, birth date, social security number. But with HIPAA, there is no restriction on de-identified health information. So here is what a covered entity is. The following individuals or organizations are subject to the privacy rule and are considered the covered entities. Those are your healthcare providers, irregardless of size of practice, who electronically transmit health information such as claims, benefit eligibility inquiries, referral authorization requests, those sort of things. Another covered entity is a health plan. They're the people who pay and provide for the cost of medical care. It could be health care, dental care, vision, or prescription drug insurers, Medicare, Medicaid, your health maintenance organization, those type of things. Those are the health plans that are your covered agencies. A healthcare clearinghouse, these are the people who process information from another entity. These are the people that provide the services. They'll receive identifiable health information and provide processing services to either a healthcare provider or some type of healthcare plan or insurer. And then business associates are the last covered entity, and they're a person or organization that is using or disclosing the individually identifiable health information to perform or provide functions, services, or activity. They may be the people that do the claims processing, data analysis, utilization review, that sort of thing. So what are the permitted uses and disclosures of health information? Well, a covered entity is permitted but not required to use and disclose protected health information without an individual authorization for the following purposes. If it's disclosure to the patient himself, for treatment, payment, or healthcare operations, the opportunity to agree or object to the disclosure of the information, and that could be informal permission that's obtained by asking the patient or resident outright. It can be disclosed for an incident that is otherwise permitted use or disclosure, and for public interest or benefit activities, such as a public health issue. Disclosure for disasters. Disclosure for disaster relief purposes, as on the screen. A covered entity may disclose protected healthcare information to either a private or public entity that's authorized by law or charter to assist in relief efforts. The privacy rule is not suspended during a public health or other emergency, but certain provisions can be waived by the Secretary of Health and Human Services. But remember, during an emergency situation, facilities should always seek a balance between disclosing patient resident information when necessary to respond to the emergency and protecting that resident's privacy. During an emergency, thinking about resident privacy may not be at the forefront. However, facilities still have to keep HIPAA regulations in mind at all times to protect their residents. Still, there are instances when HIPAA exceptions come into play, and knowing these times should make certain situations easier to deal with. As with other disclosures allowable under the privacy rule, the information released must always be the minimum necessary, except for treatment purposes, and facilities must use reasonable means to keep the residents' information protected from unauthorized use. So on the screen, you can see the emergency situations where the rule allows disclosures. Disclosures are allowed as necessary to treat patients, disclosure to a public health authority to prevent or control disease, disability, or injury, a disclosure to a foreign government agency upon the direction of a public health authority, disclosure to individuals who may be at risk of disease, disclosure to family or others caring for that individual, including notifying the public, disclosure to prevent persons in imminent danger, and disclosure to release general directory level information about an individual who was hospitalized. Section 1135 of the Social Security Act lists when the waiver can be modified and who is exempt or not exempt. During an emergent situation, the decision to share private resident healthcare information is difficult. But to ensure continuity of care, there are situations where it may be necessary to waive HIPAA. In the case of a natural disaster, a pandemic, as we have experienced, or mass casualty events, Health and Human Services can waive HIPAA requirements and penalties if the President declares an emergency or disaster, and then the Secretary of Health and Human Services declares a public health emergency. Waivers or modifications may be issued to ensure that in an emergency area during that emergency period, sufficient healthcare items and services are available as much as possible to meet the needs of individuals. The actions taken under the waiver, though, must not discriminate against anyone. While the waiver is in effect, providers are exempt from sanctions for noncompliance, but the waivers are time limited. They're terminated either upon termination of the emergency, 60 days after the waiver, or there may be a waiver or modification that lists a time frame initially. The Institute of Medicine released guidance for facilities for establishing crisis standard of care for use in disaster situations. And they offered a useful framework for sharing of information that relies on the ethics principle of justice. The Institute of Medicine's recommendation was that facilities should have a method of sharing information and medical documentation for residents under their care as necessary to other healthcare providers to maintain the continuity of that care. Facilities should also have a means, in the event they must evacuate, to release information on the residents. And facilities should also have a means of providing information about the general condition and location of residents that are under the facility's care. Which then brings into how ethics tie in with HIPAA. The core principles of hospital ethics are listed on the screen. Our ethical responsibility in any given situation depend in part on the nature of the decision and in part on the roles we as healthcare workers play. For example, a resident and his or her family have a different role and different ethical obligations to each other than the resident to his or her healthcare provider or facility. In the US, four main principles define the ethical duties of healthcare professionals that are owed to residents. And they are autonomy, which is to honor the resident's right to make their own decision; beneficent, which is to help the resident advance his or her own good; non-maleficent, which is to do no harm; and justice, which is to be fair and to treat all cases alike. All four principles are considered to be in effect at all times. In theory, each is of equal weight and importance, but in practice in this country, respect for the resident's autonomy often takes priority over the other three. When it comes to disaster management, here are the ethical issues in disaster management: autonomy, consistency. public engagement, egalitarianism, which is the thought that all people are equal with equal rights and equal opportunities, relative moral standards, withdrawal versus withholding of services, transparency, beneficent, which is the act of charity to try to advance the resident's own good, the duty to be competent, non-maleficent or do no harm, recovery, palliative care, evacuation, duty to remain safe, family involvement, and implementation issues. And all of these various issues become a part of any disaster or emergency situation. So how do healthcare workers in healthcare facilities implement this? Well, here are the ethical values and process elements that go along with disaster management. The values are the value of fairness. That's when you look at who receives what service and at what point do they receive it. Professional duty as a healthcare worker to do no harm and to not abandon their residents. Stewardship or allocating scarce resources, or utilitarianism. And that's the action that's ethical according to its usefulness or the welfare to your residents. So those are the values we always want to keep in mind with our emergency preparedness plan. And here are ways to here's process elements to help with that. Transparency. Have communication with your stakeholders. Make sure residents' families and the residents themselves are aware of what is happening or in the event of an evacuation where they will be going. Consistency. We always want to treat all residents the same. No discrimination. This is non-discriminatory. Proportionality. The response keeps elevating during the emergency to appropriately handle that emergency. And then as healthcare workers in facilities, we have accountability. We have a duty to respond. We have a duty to act. So when it comes to actually to emergency management, here's the type of events during an emergency that require sound ethical consideration. Triaging. Your staff members should be prepared to prioritize which residents would be evacuated first, prior to or during a crisis. Have that discussion, have that information available to your staff so that in the midst of that crisis situation, they're not trying to figure out who's the first to be evacuated. Allocation of resources. Staff should know what resources are available during a crisis, where those supplies are stored, and they should have the tools needed to determine how scarce resources will be issued. And then standards of care. Staff should be prepared to adjust their standard of care during an emergency. We saw this during the pandemic in 2020. I spoke with several long-term care facilities where they had to train individuals to provide care normally outside of their professional practice. They may have had maintenance people assisting with environmental services. They may have had environmental services people assisting with dietary. They may have had CNAs that had to assist with both of those areas. So please make sure staff are prepared to adjust from their normal role and that they have been trained to provide care outside of their normal practice. So with each of these webinars, we try to provide you with some tools that you can use within your facility to help implement some of these things that have been discussed into your practice or into your emergency preparedness plan. So the tools we're going to go over today is the disclosure decision tree, a HIPAA waiver toolkit, the Pennsylvania Healthcare Coalition map, and of course the contact information for the authorities' IPs. So the first one is a HIPAA waiver toolkit that was prepared by the Minnesota Department of Health. It is shared governance. The Minnesota Department of Health has been very generous that facilities across this country can access this toolkit, evaluate it against your emergency preparedness plan, see if you have the elements of this toolkit within your plan. The link to access this toolkit is at the bottom of the screen. I would strongly encourage you to go into that site, review that waiver toolkit, and then, like I said, again, compare it against your emergency preparedness plan to see if you are meeting these basic standards or if there's areas you need to improve on your plan. The second tool was developed by Health and Human Services. It is a HIPAA privacy decision tool for emergency preparedness planning. And the link to this is at the bottom of the screen. The U.S. Department of Health and Human Services published this interactive decision tool that's designed to assist emergency preparedness and recovery planners in determining how to access and use health information, consistent with the HIPAA privacy rule. This tool helps guide emergency planners through a series of questions regarding how the privacy rule applies to a particular disclosure. By helping focus on the source of information being disclosed and whom it's being disclosed to, and for what purpose, as a user, you'll better meet the needs of elderly people or people with disabilities in the event of an evacuation. And it's a very nice flow chart to understand. There's 4 sections. One is disclosure to a public health authority, disclosure related to treatment or public health, disclosure of a limited data set, and disclosure with individual authorizations. And then you can just follow the flow chart through to see what can be disclosed. So that's another tool for your use. That is an excellent tool or resource for you. The third tool, and I know you see this every webinar, but we sometimes have new people joining that have not been on previous webinars. The link is there at the bottom. This is the Pennsylvania Department of Health Healthcare Coalition Map. A healthcare coalition is a formal collaboration among healthcare organizations and public and private partners that are organized to prepare for, respond to, and recover from an emergency, a mass casualty event, or a catastrophic event. The map is very easy to use. The regions are broken out by county. You can find your county on the map, and then if you follow it up to the information box, it'll tell you what coalition you were in and provide contact information for you to that regional coalition. Please keep this handy. Please keep this as part of your emergency preparedness plan. And please make sure you have a flow of communication with your regional coalition. They can be of great benefit and assist you during an emergency situation. And of course, you always have the infection preventionist here at the authority as a resource for you. Our contact information and phone numbers are at the bottom. Amanda Bennett is currently off on extended leave. So if you have any issues or questions or concerns, direct them to me or to Christine Bingman. Here's also the links to the resources that were in the toolkit, if you want to pull them up that way as opposed to going back to the slides. We also have our guest experts for you. Jason Brown is on this phone call with us. He is the Director of Emergency Management, of Healthcare Emergency Management for the Public Health Management Corporation. And Jason brings over 20 years of experience in emergency response and management. And he is on the call today. Thank you, Jason, for being on the call. But what questions do you have for me concerning today's webinar, or if you have other questions that can be directed to Jason? Kathy, I'm now going to turn this over to you.
Yep, thanks, Joanne. So that concludes the slide portion. If we must evacuate the facility in a disaster, is it okay to share health information with the transporting agency?
Yes, the HIPAA rule allows disclosure as necessary to treat residents, but always remember it has to be the minimum necessary. And you have to use reasonable means to keep the residents' info protected. But the people doing the transport would need to know the minimum necessary to transport that resident safely. Does the resident have behavioral issues that may be exacerbated by being placed into an ambulance? Does the resident have some type of physical skeletal issues that will determine the best way to move them and place them? So that information can be disclosed, but just remember, it's always minimum necessary. And remember what the Institute of Medicine recommended, that you have a method in place for sharing this info and medical documentation for your residents. Have that planning done in advance so someone's not trying to do that in a hurry. And I have to apologize, Pamela Drake is also on the phone or on this webinar, and I just missed you, Pam. I'm so sorry. Pamela is the associate or is the deputy director for the healthcare emergency management and brings a wealth of knowledge as an emergency planner for facilities and also as a consultant. So I do apologize, Pam.
Joanne or Shelley, I'm not who best to respond, but I did see a question, this is actually in the chat box, about can those resources be shared via email after? I'm not sure if we have or we send them out or if they're on the slide, but I just threw that out there.
So all the resources can be found in the PowerPoint presentation, which the link is provided in the chat box. And it was emailed out in advance to those that did register.
One other question here. Are there times when the HIPAA rule is suspended?
I know we did discuss that during this presentation. The rule itself is never totally suspended due to a public health or other type of emergency, but the Secretary of Health and Human Services may waive certain provisions of the rule during an emergency situations. But always remember, and I'm going to keep repeating this, you need to try and balance disclosing resident information when necessary to respond to the emergency with protecting the resident's privacy. So always remember minimum necessary. If you have any other questions, maybe not related to HIPAA, but as we have two experts on this webinar, Pam and Jason, if there's other questions related to emergency preparedness that you'd like to address to them, please type them into the chat box now.
Joanne, just to follow on to that question, in past evacuations, and I'll use long-term care as the example, managing the information flow of keeping track of the patients as we find placement for them is one set of information. Once information is provided, or once placement is provided, an additional set of information would be there to provide to the next provider that's going to carry on that the care to that patient. How we're going to get them away from the facility, how that care is going to be continued on is a different data set. Most often, the face sheet going with that patient to the next care provider works that. Just recognize that there's two different levels of that data set from an evacuation standpoint. Those are continuing the care and those that are managing the evacuation. As Joe had pointed out, specifically to the role that they're doing. Limited information that completes the task and nothing further.
Thanks, Jason.
Just going to share some last minute information. If there's any last minute questions, please go ahead and type them in. But while we're waiting, I'm going to share that this educational offering provides a certificate of continuing education for 0.5 continuing education hours. With that, I will thank everyone for joining us today. If you experience any issues accessing the evaluation and or certificate of continuing education, please feel free to direct any inquiries to Shelley Meixel at shmixell@pa.gov. And this concludes our webinar. Thank you.